This video will explore the use of various types of equipment to aid in patient mobility. Lifts can come in various types and are designed to assist in transferring a patient from one surface to another if the patient is unable to assist the healthcare worker in that transfer. Lifts are often either electric or manual in nature and can be found via portable machines or through a ceiling-based lift that is along a track system. Accompanying the lift is the sling. Slings come in various forms and can be disposable or reusable. Some are considered to be sitting slings as they get the patient to be in more of a sitting position, while others allow for the patient to be supine in the transfer and encompass the patient's whole body. Sitting slings can come in a mesh material or with a cutout on the bottom that allow for transfers to shower chairs and toilets for improved participation in hygiene and grooming tasks. In order to transfer a patient, a sling is placed under the patient while the patient is in bed or in a chair. When in bed, the patient can roll from side to side with assistance from the healthcare provider as the sling is placed underneath them. Once the sling is in place, the lift is positioned with the arms of the lift over the patient's center. The straps on the sling are then attached to the lift arms, and after testing for security, the lift is able to be raised or lowered to move the patient between the two locations. Portable lifts have locks on the wheels for safety and a steering mechanism to allow for a safer transfer. When using a lift, always have at least 2 people present, one to monitor the lift and another to monitor the patient. Also, always check the weight limitations of both the sling and the lift prior to use. Standers and raisers are designed to allow a patient to come to a standing position, often for early mobilization programs, but can also be used for patient care tasks or transfers. Manual standers often require the patient to have the ability to sit unsupported and to be able to come to at least a partial stand with or without assistance. The electric standers come with a harness and require the patient to be able to maintain their trunk balance in a sitting position. Mobilization chairs can be used for patients who do not have the ability to come to a sitting position and are designed to start early mobilization by placing them in a standing or sitting position. Some even have the option for side-lying assistance. To use the manual lift, a patient is assisted on sitting at the edge of the surface that they are on, and the lift is guided in front of them as their feet are placed on the foot plates of the lift. Manual lifts have locks for safety once it is in place. The patient is then assisted to a standing position as the seat is positioned underneath the patient. The patient can then sit on the stander seat, and the device can be unlocked to allow for transition from one place to another, like a bedside commode or a wheelchair. This device requires the patient to be able to stand for long enough to get the seat underneath them. When using the battery-powered lifts, the patient starts in a sitting position with or without minimal stabilizing support from a healthcare worker. The harness is fastened to the patient and tightened as the lift is placed in front of the patient, then locked, and their feet are placed on the foot plates. Depending on the stander, it can possibly have the support of harnesses around the legs, or may just have the main trunk harness. Once the straps from the harness are secured to the stander, the patient is instructed to hold onto the handles of the stander and is guided into a standing position by the healthcare worker. The stander is able to be unlocked as the patient is then able to be transferred from place to place. The benefit of the powered stander is that with the harness, the lower half of the patient is free, which allows for easier ability to complete wound care, lower body dressing, or toileting hygiene while in the standing position. Patient mobilization sheets, or low friction sheets, are designed to assist in mobilization in bed by reducing the friction from the patient on the bed. Sheets range from disposable, basic reusable sheets with handles, and air sheets that are placed under a patient and then filled with air to reduce the friction. With in-bed mobilization, sheets can be used to raise a patient to the head of the bed or lower to the foot of the bed. It can assist with rolling a patient left and right and side to side in the bed. Friction-reducing sheets can also help a patient to scoot closer to the edge of the bed or positioned with slide boards to aid in slide board transfers. An important reminder is to never leave a friction-reducing sheet under the patient, as it can increase potential for falls. Hospital beds are the most convenient equipment to use as they are always already in the room. The controls to assist a patient into more of a sitting position can help reduce burden and getting the patient to sit at the edge of the bed by reducing the amount the healthcare worker needs to lift from supine. This also allows the patient to assist more by reducing the effort it takes for them to come to a sitting position. Controls can also be used to place them in a Trendelenburg position that makes it easier for the patient to slide to the head of the bed or reverse Trendelenburg to slide to the foot of the bed. The bed can be raised or lowered to the waist height of the healthcare worker to reduce lower back pain from bending over the patient when performing patient care. And the cutouts within the railings allow for patients to assist in rolling side to side and adjusting themselves in bed. The hospital bed is a simple tool in a healthcare worker's arsenal that can make a huge difference in reducing injuries during patient handling. The biggest barrier to equipment use seen in hospital systems is the accessibility of the equipment. However, this can be improved by implementing some simple steps. Having designated placement of the equipment when not in use for ease of access, having multiple batteries for powered equipment and designated charging ports in easily accessible areas, and keeping open communication amongst healthcare staff on the location and use of the equipment. Some important reminders when deciding to utilize equipment. Equipment should be maintained and monitored frequently to prevent possible injury to the healthcare worker and patient during use. One piece of equipment may not be the best fit for every patient, so it is important to determine the needs and capabilities of the patient when deciding on a piece of equipment to use. If ever unsure if you are able to mobilize a patient, determine if a certain type of equipment would make the mobilization easier for you. The time it takes to get equipment needed for patient mobility is minimal compared to the time lost if an injury were to occur.